guys, it's Nurse Jen. I'm here after about a year posting my first and only video on YouTube, but I swear this time I'm back to regularly post videos about nursing school in Canada. So I thought I'd give you guys a little bit of an update, and I want to overwhelm you because there's lots to talk about. So I'm going to try to make this video around 10 minutes. Basically just describing some things I learned and wish I knew going into nursing school in Canada. As many of you already know, I go to nursing school in Toronto. I'm in university in an accelerated BScN program, and honestly the first year was super hard but definitely worth it. I enjoyed it a lot. I made a lot of new friends. I learned a lot in clinicals and got right into the hospital right off the bat of starting. The classes were interesting and I just loved what I learned all the time, which wasn't really similar to my last undergrad, but yeah, it's been a great time, and I passed my courses with flying colors. I did really well on all of them after a lot of hard work, and so yeah, let me get started. So the first thing I learned in nursing school and wish I had known is how much of a change NCLEX style questions are from other exams, like general exams like physiology or like bio or whatever you took in your other undergraduate degree or just as a general course. There are a lot different nursing style questions. If you guys don't know what the NCLEX is, it's basically a licensing exam for registered nurses in Canada and in the US. So what an NCLEX style question would be like, for example, is like select all that apply, which will have a question and list like 6 different answers, and you have to select all of them that are right and obviously not select the ones that are wrong. And that was a really hard, like usually they don't put mini questions on there, select all that apply, but the only thing is they're worth 1 mark, and if you don't select one of the ones that are right, even if you select all of the other ones that are right, you don't get the mark. So it's very easy to not get those questions right. So my tips and tricks for you, just a really quick trick, is to treat it like a true or false question, where you read the question and each of the options of the answers it gives you, you'd be like, okay, you start at A. Is that true or false by the question that they asked? Yes, no? Then you go to the next one, and then you just treat them all separately, and in the end it really works out in your favor because it's less overwhelming and it really helps you focus your attention on what they're asking you. Also, there's many like questions that will be like, so it will give you a question and say, what is your first action as a nurse? And these are also really hard because all the answers will mostly be an action towards this condition or these symptoms that the person's having. Like maybe it's like take their vital signs, or maybe it's administer something IV, or maybe it's call the doctor. Like you don't like all of these different options. It's hard to know which one's the most appropriate, but you just have to think. This is how I always think. What answer best puts the patient in a safe situation and looks out for their safety? Like what would guarantee their safety? Because you're always making sure that the patient is safe. So obviously you're not, if a patient is critically ill with all these symptoms, you're not going to just be like, okay, so I'm gonna, check their vital signs in 2 hours. No, like you need to check their vital signs right away. So you always have to think in that way. And it can be challenging because a lot of the different answers are pretty similar in acuity. Like they won't usually give you like obvious answers. Like it's not usually obvious, it's pretty hard, and so you really have to use your critical thinking, but always look at which answer will be the best for the patient's safety, and I will give you some examples of questions right after this I'm talking about. Yeah. And so another thing I learned in nursing school is what you should do, and I really recommend asking questions in clinical. Ask questions to other students. This is better if you're very intimidated by like other nurses and clinical instructors, but also really recommend asking questions to a nurse you might be shadowing or working with, and to your clinical instructor, because trust me, you might feel embarrassed or like you might feel like you're dumb asking questions, but no, that is how you learn. I don't know about you guys, but that's how I learn. I ask questions all the time, and no one, like, even if they roll their eyes, or honestly, it's worth it in the end, because it's for the safety of the patient and your own knowledge, and you're going to be a practicing RN, and who knows how long, however long it's going to take you, but eventually you'll get there, and you can still ask questions then, but you're expected to know a lot more versus being a student. So I recommend using those opportunities to always ask questions. Like, if your nurse is administering a medication, like, ask her, what's that medication for? Like, why do they need it? Like, why did you decide to give that medication instead of this medication? Like, why is that recommended? Like, maybe they're not sure, but usually they know about these things and why this is preferred. Like, maybe a patient is on blood thinners, so they can only be given a specific medication, or, you know, maybe they have high blood pressure or something. You never know. So it's really good to know a lot about the medications you're administering, and you're supposed to know. So you should ask questions about anything relevant to nursing, like, and take opportunities as well. It's really hard because you can miss out on a lot of opportunities as a nursing student if you don't have the confidence to go and ask to have those opportunities. For example, like, you hear that a nurse is administering a catheter. Ask that nurse if you can insert the catheter, and she can guide you. Like, I know sometimes it's hard to do those things, but you really got to put yourself out there and ask and those questions and get those opportunities to really get a full experience and be the best nurse you can be in the future. Another thing, number 3, is to allocate a lot of time to studying, dependent upon how much time you think that specific course will need. For example, pharmacotherapeutics and pathophysiology. Like, for me, I don't know about you guys, you might be different learners, but I need a lot more time than community health nursing. Not to put community health nursing down, but I grasp that material way faster than I do a list of drugs. Because pharmacotherapeutics, you need to know, oh my gosh, you need to know drug interactions, side effects, contraindications, dosaging, timing of dosages, you know, all those different things. The list goes on, and it's really easy to mix all of the side effects up with different drugs, and mix up the names, and mix up the class of drugs, and you really need to know your stuff. So, and it's really easy to go to the test and be like, I forget. Like, so easy to go out your mind. So for that, I usually dedicate at least a week to studying, depending how efficiently you are keeping up with the material. But I usually take a week to study for those midterms. Well, community health, maybe 2 or 3 days, a full day studying. So allocate your time, and don't put yourself in a situation where you have to memorize all these drugs in like 2 days, because it's doable, but for some people, but for me, that's not recommended. So allocating your time is really important. Another one is number 4, is a lot of nursing students are very type A, and don't be intimidated if you're type B or you're your own type A and you're not used to being around a lot of type A people, because nursing students will email profs about things. They will ask a lot of questions in class, and like really be active on like any kind of like social media, Facebook pages you guys use to like communicate. Like, they'll be very, very ahead of the game always. Not all nursing students, but most. And honestly, take that as a good thing. Take it as an incentive to also be ahead of the game and active in your own education. Because even if you're a type B person, like, it's almost good to have these type A's around, because if a prof messes up a question on an exam, they're gonna be the ones emailing the prof and you don't have to. And so we always joke about that, me and some of my friends in the program, like, usually if there's an issue, it gets raised. So it's very nice to have these type of people, and they'll really, not only are they like very like stern about like getting good marks and succeeding, but like they'll also help you. Like, a lot of them are very helpful, and like nursing is a very close-knit program, especially my program, so you'll love that community aspect of it. So yeah, so don't be intimidated. And number 5 is, you're always going to be changing your nursing specialty, what you want to do in nursing specifically. For example, like, I'm interested in labor and delivery, NICU, cosmetics, public health, oncology, emergency. Those are like the major fields I'm interested in. And I know I named 6 different specialties right there, didn't I? 6 or 7? And I'm already halfway through my nursing program, and I'm so open to all these specialties, and it's okay to be open to all these specialties, because you will find your niche. And once you graduate, if you still don't know what you like, just apply to what you're interested in, and you can always switch around. And that's honestly the beauty of nursing, is that there's so much diversity, and I can name literally 40 different things you can do as a nurse. Like, it opens up so many avenues. And so just be happy that you have these options, and you don't have to be stuck in a field of nursing that you don't really like. You can always change, and there's always going to be something out there for you. So those are basically some recommendations and things I learned as a nursing student, and I'm entering my 2nd year in a few weeks, and that will be my last year since it's an accelerated program. And I'm going to keep you guys updated. I'm going to post more videos even before I start to give you a little recap of my year and things I learned, and I want to share with all you future nurses or people who are just interested in the healthcare field. So thank you for watching. I'll see you guys next time.